Personal hygiene for healthcare workers. Personal hygiene is crucial for healthcare professionals to prevent the spread of infections. Do's and don'ts of personal hygiene required to be followed by healthcare professionals. Do's. Wash your hands thoroughly and frequently, especially before and after patient interactions. Use hand sanitizers when soap and water are not available. Wear appropriate personal protective equipment, PPE, such as gloves, masks, gowns, and eye protection. Keep your nails short and clean. Cover any cuts or wounds with waterproof dressings to prevent infection. Maintain good oral hygiene by brushing and flossing regularly. Follow proper respiratory hygiene, such as covering your mouth and nose when coughing or sneezing. Follow the guidelines of proper disposal of used PPE and other medical waste. Don'ts. Don't wear jewelry on your hands or wrists that can harbor germs. Avoid touching your face, especially your eyes, nose, and mouth. Don't skip proper hand hygiene even if you're wearing gloves. Avoid working while you are sick to prevent spreading illness to patients and colleagues. Remember, maintaining strict personal hygiene is important for healthcare professionals to ensure the safety of both patients and themselves.
DPMI सिर्फ शिक्षा हुनर ही नहीं बल्कि सम्मान के साथ सुनिश्चित रोजगार।
Thank you, DPMI.